Late Night Health continues. I'm Mark Alyn. Our guest, as we wrap up our show today, is Gary Leach. He's a urologist, a leading urologist with Tower Urology in Los Angeles, in the Beverly Hills area. And we just spent some time talking about male incontinence. Let's talk a little bit about erectile dysfunction. Is there any relationship, doctor, between male incontinence and ED?
There is a relationship, Mark, in that we see a lot of men after a prostate cancer surgery that have both problems. That they have ED because maybe there's been some damage to the nerves that control erection during the surgery, and they may have incontinence because of some damage to the valve muscle, which sits right in front of the prostate. So sometimes in the process of removing the prostate for cancer, that valve muscle can be damaged, and so the person can have that combined problem after the surgery of the erectile dysfunction and having a significant, we call stress incontinence, leakage when they cough or sneeze or laugh.
Wow. And what about, obviously, you don't want cancer, but a lot of the, my understanding is that some of the prostate cancers are slow growing, and depending on a number of things, you may not need to have it removed, just checked on a regular basis.
That's true, Mark. A lot of it depends on the person's age and what the biopsy of the prostate shows as far as how aggressive the cancer might be. So particularly for older men with really non-aggressive cancers, that what we call watchful waiting can be an option. But, if you're a younger man in your 50s and you have an aggressive prostate cancer that's localized to the prostate, surgery for many people is the best option because that gives them the best cure, the best chance of cure from the prostate cancer.
And what about, can you do partial removal, or is it all or nothing?
For cancer, it's all or nothing. But again, there are other options like radiation therapy and hormone treatment and other things. But surgery is not the only option. But for selected individuals, it can be the best chance of cure. And if somebody does have problems afterwards with either incontinence or erectile dysfunction, we can fix that.
And what about looking at ED caused by other things such as diabetes? Mm-hmm. I mean, that's a big one. Yeah.
It used to be thought many years ago that if a man had erectile dysfunction, that probably was psychological. That is a psychological issue, and the person should go for counseling, that sort of thing. But now we realize that 95% of the time there is a physical cause for the erectile dysfunction. So that may be, as you mentioned, diabetes. Commonly, it could be the very small arteries that carry the blood to the penis getting blocked up, just like you get blockage of the vessels in your heart or elsewhere. We call it atherosclerosis.
Mm-hmm.
There can be nerve problems that can affect it, like Parkinson's disease, or somebody's had a stroke, multiple sclerosis, these sorts of things. But almost always there's a physical cause for the erectile dysfunction. And the good news is, again, that it's treatable. It's not something that a man has to live with.
And what about, for a man who doesn't have prostate cancer, what about some of the over-the-counter, erectile dysfunction pills?
Yeah. I would say most of the time, Mark, it's a waste of money, and the person would be better off just going to Las Vegas and putting their money in the slot machine. A lot of these are herbal remedies that are really not effective. I had a patient that brought in some ground-up billy goat horn. It cost him like $80 for a little bottle of these pills. So,
billy goat horn.
Yeah.
Oh, man. No.
So it's much better, instead of doing things over the Internet, to go and see a specialist in this area. We can do special tests in the office to tell us exactly why the erectile dysfunction is occurring. And again, there's effective treatment available, whether it's medications, injection, and we do a fair amount of surgery, too, with a special kind of implants to allow the man to be able to function sexually. And these are some of the most satisfied men in my practice.
Gotcha. And, of course, people, if you want more information, you can go to edcure.org, edcure.org, binding solutions together, because, sex is really a part of life. It's and a good part of life, I might add. Hey, Doctor, thank you very much for joining us today.
Thank you, Mark.
And we appreciate it. Look forward to talking to you soon. I'm Mark Alyn, along with Daryl Wayne. Daryl, thank you, sir.
My pleasure.
And look forward to seeing you next week. Same time, same station.
I'll be here.
I will be here as well. Listen, everybody, have a good week, have a safe week, and most importantly, have a healthy week. We'll see you next time. Bye-bye for now.